Mr. Chairman. It's my pleasure to be here and present the burden of cardiovascular disease and risk factor in Kazakhstan, Central Asia presentation. So just for some people who don't know about Central Asia, because Central Asia, or in this definition, 5 Central Asian countries of former Soviet Union countries became independent only in 1991 after Soviet Union disintegrated. That's why probably some older people and younger people don't know about this country. But still, so as you can see on the east, we are bordering with our esteemed host, China, on the north, Russia, and Iran, Afghanistan on the south. So it's very, it's very country very close, has a very common history and languages, but quite different on economics. Kazakhstan and Turkmenistan have a vast natural resources, and that's why the economy is doing well. But some other countries belong to low mid-income or low-income countries. But still, I can say that we still have very common problems, especially in cardiovascular care, cardiovascular disease. So this presentation is mostly based on data from Global Burden of Disease. You perfectly know about this organization that is the single largest and most detailed scientific effort to measure levels and trends. I was probably the first collaborator of GBD in Kazakhstan and Central Asia. So as you can see from this slide, it's very sad situation. 51% of total deaths belong to CVD mortalities in Central Asia, compared to only, let's say, 33 in the world. So why? What's wrong? Yes, that's why. And you can see on this bigger map. So actually, not only Central Asia, but whole former Soviet Union has a very high burden of disease. Here is ischemic heart disease, but still cardiovascular disease. Regarding trends, so it was high in the 1990s, but after the disintegration of Soviet Union, it became even worse. It was a very difficult period of economic transition. So you can see the mortality rates increase sometimes twice, or but hopefully are going down. Approximately in 2000s, and Kazakhstan, as the most economically developed country, is doing better, but still not even closer to our hosting East Asia region, and especially high-income countries, which is not. So this is about stroke mortality. It has a very similar trends. You see that in Central Asia, stroke mortality is much higher compared not only high income, but global, which is closer usually to low and middle income countries. So, and especially ischemic heart disease mortality is very high, highest probably in the world. And as you can see here, we have two lines from Central Asia. I took two biggest countries, Uzbekistan and Kazakhstan. And Kazakhstan is improving the situation recently, but still, again, even not closer to East Asia and Southeast Asia. But Uzbekistan, it's the biggest, most populated country in Central Asia. It has a mortality on AD around 400 per 100,000, which is actually not different from the 1990s. It's probably one of the few countries which really didn't improve. I hope that there is no Uzbek brothers here because sometimes they don't feel comfortable with this. But and especially another peculiarities of Central Asia is that premature CVD mortality is very high, and in Central Asia is very high, as I said. but I just put for the comparison the premature civilian mortality in Eastern Europe, and this is mostly Russia. You can see it increased several times during economic transition, and still going up much higher than even in Central Asia. So I show this slide that we share the same, probably sad heritage and problems. But in other countries, it's completely different trends. So just as an example, death rates from civilian mortality in the United States increased almost 5 times from the times of 1970 approximately, and now it's around 100,000. So many studies, investigated why it happened, which intervention make a difference. So one of the famous study showed that risk factor actually contributed the most to the reduction of civilian mortalities, almost 55% here, and medical treatment was responsible for 47. And it's not only in the US, almost in every country we have similar results. Some study in Finland shows even 76%. It's probably famous North Korea study, 76% are responsible for the reduction of civilian mortality. So risk factor in Central Asia. As you can see, compared to high-income countries, so we have very big risk factors, and also these 3 big risk factor groups, which is environmental, behavioral, and metabolic countries. They increase in all Central Asian countries. In Kazakhstan, it's a little bit less, but still much higher, bigger than in other countries. Yes, and the ranking of these risk factors shows that high blood pressure is number 1 risk factor, but for example, in Uzbekistan, dietary risk takes first place, and so other risk factors I will mention later. So this is a little bit busy. I just wanted to show that all these 5 Central Asian countries has a similar, trends. They're still high, and Kazakhstan is the lowest one. So environmental risks, which were detailedly explained by distinguished previous professors, also exist in Central Asia. They are more advanced in the countries that has more rural population, like Uzbekistan and Turkmenistan probably. Behavior risk, as I said, especially was very high in the 90s, but now gradually decreasing. And in 90s it was mostly alcohol-related behavior risk, and together with tobacco. But as we've seen in the trends with Russia, so actually we share the same problems, but now it's getting this alcohol-attributable mortality going down. But probably now is suboptimal diet is getting much higher. As also previous speaker mentioned, so suboptimal diet is responsible for more than 4 million ISD deaths, and it's decreasing in the world, but Central Asia is the only region in the world where there is little or no decline in ISD mortality. And Central Asia exhibits the highest age-standardized rates of diet-related ISD deaths. So this is going in detail for suboptimal diet risk, and in Central Asia it's diet low in nuts and seeds, the highest in the rank, and then diet low in seafood, omega-3 fatty acids, which is not probably how to say, it's understandable because all our countries are landlocked countries, so-called. So diet is low in legumes and whole grains also contribute the most. And of course, metabolic risks are the highest group number, and all, as you can see from this slide, they are much higher than global again. So global probably is average to like China and India, the bigger country. So as you can see, much higher metabolic risk here. As I said, systolic blood pressure is the highest from the metabolic risk and all risk factors. And another significant risk factor is high LDL cholesterol. You can see it's much higher than other countries. And of course, it's not probably relevant to these sessions, which is concentrated on lifestyle, but still health system, where cardiology and low quality health system also plays approximately the same contribution, which was shown in the paper related on universal health coverage. And especially you can see that cardiovascular disease very much depends on the poor quality of healthcare. And this how it looks on the global map. Our countries and some other Asian countries has a higher poor quality indicators. But Kazakhstan is actually, as you see from this slide, has a quite a high percentage of CAPS, which is coronary artery bypass surgery. And like this, as I said, historically we belong, as a former Soviet Union country, we belong to European Society of Cardiology. So Kazakhstan has a almost equal, bypass surgery per million people with some other European countries, developed countries. And the same is regarding to percutaneous coronary intervention. But still, you see, the problem goes on the primary healthcare level. So here you can see low therapeutic control of hypertension, low use of lipid lowering drugs in Kazakhstan. This is a result of Aspire 5. We participate in several years, and also not enough, LDL reaching target level of LDL in our countries, and the same is regarding glucose control. So let me go to the conclusion. So high mortality rates are driven mostly by all these group factors. The biggest group factor is metabolic risk factor, behavioral risk factor, and suboptimal diet is inside this behavioral group, and environmental risk factor also quite high. So our conclusion: the focus on policy response should be prioritized to reduce premature severe mortalities. I understand that here we have a colleague who understands this, but when I speak on the cardiology meetings in Kazakhstan, I'm probably the only person who is talking about this, but most people talking about surgery and how many transplantations were done. But this is just an example that we have to do our lessons first in prevention to reduce severe mortality. So, and of course, some lack of coverage of lipid lowering hypertensive drugs and insufficient therapeutic control of blood pressure and LDL cholesterol. And thank you for your attention. This is a picture of my hometown, Almaty. I invite you all come here, you see, to see these beautiful mountains. Thank you.